Hello everyone, I am Pranay from Family Third Year. I am going to discuss about methotrexate drug profile. Coming to introduction, methotrexate is a FDA approved folic acid antagonist indicated for the treatment of rheumatoid arthritis because of its high potency and efficacy. It can also be useful in patients with juvenile idiopathic arthritis. Werner is the first scientist who is performing a double-blinded placebo-controlled clinical trials of methotrexate in patients with rheumatoid arthritis. Aminopterin is the parent compound for the methotrexate, first used successfully to treat leukemia. Methotrexate is one of the major chemotherapeutic choices for various types of cancers. The medication is also safe and effective for patients with psoriasis, systemic lupus erythematosus, inflammatory bowel disease, vasculitis, and many other connective tissue diseases. The medication is also effective in patients with organ transplantation because of its anti-inflammatory and immunomodulatory activity. Methotrexate can be combined with anti-TNF agents and has shown effective in managing patients with ulcerative colitis, lymphoma, carcinoma of the breast, small cell carcinoma of lung, epidermal tumors of the head and neck, and carcinoma of the ovary. Methotrexate is used in offline cases of mycosis fungoides and dermatomyositis and pityriasis and eczema and non-metastatic osteosarcoma. Coming to mechanism of action, methotrexate has distinct mechanism of action regarding its use in chemotherapy and immunosuppression in autoimmune diseases. In cancer, methotrexate acts as an antifolate antimetabolite. Methotrexate is taken up into the cells by a carrier called human reduced folate carriers, that is SLC19A1, and it forms methotrexate polyglutamate. Both the methotrexate and the methotrexate polyglutamate inhibits the enzyme dihydrofolate reductase, which catalyzes the conversion of dihydrofolate into tetrahydrofolate, the active form of the folic acid. The tetrahydrofolate is necessary for the synthesis of nucleotides of both DNA and RNA. Thereby, methotrexate polyglutamate further inhibits the de novo purine synthesis of both pyrimidines and thymidine synthesis, thereby inhibiting the DNA synthesis. And coming to mechanism of action of in autoimmune diseases, it inhibits the AICR transformase enzyme, leading to the accumulation of adenosine and guanine accumulation. Anti-inflammatory action of adenosine leads to the repression of T cells activation, downregulation of beta cells, increasing activated CD95 T cell sensitivity, and repression of methyltransferase activity, thereby inhibition of binding of beta 1 interleukin of the cell surface receptor. Before going to understand the methotrexate, a pre-methotrexate evaluation is necessary, and they includes the following tests like checking CBP and RFT, LFT, HIV, and urinalysis test reports. Methotrexate is administered orally and as well as injections in both intramuscular, intravenous, and intrathecal and subcutaneous routes. Orally dosing is a weekly and administered as a single dose or in 3 divided doses over 8 hours in 24 hours every week. Folate supplementation with 1 mg per day or 5 to 7 mg once a week should be considered for all patients to prevent bone marrow suppression. In adults, oral absorption is dependent upon the dose taken. Peak serum levels are achievable within 1 to 2 hours. Injections having methotrexate certain doses such as 7.5 mg, 10 mg, 12.5 mg, 15 mg, 17.5 mg, and etc. Combinations used in rheumatoid arthritis. The combination of methotrexate plus sulfasalazine plus hydroxychloroquine and methotrexate plus most biological DMARDs means disease modifying anti-rheumatoid drugs improves the disease activity. Other treatment combinations like methotrexate plus hydroxychloroquine, methotrexate plus leflunomide, methotrexate plus gold injections may improve the activity in people who do not respond to methotrexate alone. In these conditions, the combination regimens are used. The combinations of methotrexate plus several biological DMARDs like adalimumab and etanercept and cetrolizumab and infliximab reduce the joint damage. The combinations of methotrexate plus thiopurine and methotrexate plus cycloserine and methotrexate plus tocilizumab 8 mg per kg probably increase the chance of stopping the medication due to a side effect. These are some of the drugs of the methotrexate and having different colors and shapes. And the drug is belongs to the drug class like anti-metabolites, anti-psoriatics, anti-rheumatoid, and other some immunosuppressants. These are the drugs available in Cipla company and their prices. The prices are vary depending upon the doses. Coming to the pharmacokinetics, it's a low dose methotrexate rapidly absorbed from the GIT and 50% plasma protein bound. It can be displaced by salicylates and sulfonamides, largely excreted in the form of unchanged form in urine. Excretion decreased by aspirin and probenecid. It is not recommended in patients with impaired renal function. Coming to side effects, the most common adverse effects are gastrointestinal manifestations such as nausea, vomiting, mucosal ulcers, and loss of appetite. The major adverse effects of methotrexate is hepatotoxicity, and folate deficiency is also seen and can be prevented by supplementation like folic acid supplements are given. Over long duration of treatment, ultrasound scanning of and liver biopsies are required to know the amount of liver damage. With higher dose of methotrexate, there is mucosal ulceration and sign of methotrexate toxicity. The mucosal ulceration is a sign of methotrexate toxicity with higher doses. And fever, fatigue, low levels of WBC, GA bleeding, pancreatitis, bone marrow suppressions. These are the other side effects of methotrexate. Coming to contraindications, methotrexate is contraindicated in hypersensitivity reaction to the medication and pregnant and breastfeeding women because the methotrexate is excreted in breast milk also. Thereby, it is contraindicated, and it is contraindicated in pre-existing blood disorders such as bone marrow hyperplasia, leukopenia, and thrombocytopenia. And it is in case of rheumatoid arthritis and psoriasis, it is contraindicated to use methotrexate in patients with chronic liver disease and liver cirrhosis, alcohol hepatitis, and chronic alcoholism. It is not recommended. It is recommended in HIV and AIDS condition and renal dysfunction conditions. Monitoring parameters. Patients taking methotrexate should undergo monitoring of CBC, serum creatinine levels, transaminase levels, recommended weekly for the first 4 weeks and then twice in a month. LFT is the monitoring parameters. We have to check serum levels and AST and ALT levels, and liver biopsy can also be done in case of hepatotoxicity. Creatinine clearance is also monitored. Monitoring of pulmonary toxicity is also causes pulmonary toxic condition, hence we have to monitor the pulmonary test by using baseline chest radiographs recommended to detect the interstitial and alveolar infiltrates. Methotrexate may also cause reactivation of tuberculosis in endemic countries, so we have to monitor toxicity. High dose of methotrexate is a term for high dose higher than the 500 mg per ml. To manage the methotrexate toxicity, immediate leucovorin administration is done. In case of renal failure, adequate hydration and urine alkalization with sodium bicarbonate are necessary. The 3 antidotes are used for methotrexate toxicity are leucovorin, thymidine, and glucarpidase. Leucovorin is the reduced active form of folic acid. It reduces normal cells from the toxic effects caused by methotrexate inhibition of reduced folates. Leucovorin is particularly effective in preventing a myelosuppression, gastrointestinal toxicity, and neurotoxicity during methotrexate treatment. Glucarpidase converts methotrexate into DAMPA and glutamate, two non-toxic metabolites, those rapidly removing methotrexate in patients with renal dysfunction. Glucarpidase in combinations with leucovorin is a common therapy for methotrexate toxicity. A single dose of glucarpidase reduces plasma methotrexate concentrations by 97% more within 50 minutes. Leucovorin therapy should continue for 48 hours after glucarpidase administration. These are the references I have collected data from these sites. And thank you.